Doctors have read it. When was a patient right about something but you insisted they were wrong until it got serious? It didn't get serious under my father's care, he just thought she was joking at first. He was treating a woman for headaches and she dropped that she had been the getaway driver in a robbery where shots had been fired. Bullet was lodged in base of her skull. Psychiatrist here, late to the party but thought I'd share a story from my residency years in case someone happens to still see this thread. I was at the brief internment unit, acute psychotic cases, mostly, and there was this woman that had been there for some time. She had paranoid delusions about the Russian mob trying to get her, complete with hallucinations and everything. Her family had confirmed it was all made up in her head and nobody was following her. She had been getting medication for some time and her symptoms had improved a lot. She no longer believed she was in danger or being hunted, and everything seemed to be going well. As the procedure usually goes, the staff contacted her family so she could start going out for the weekends with them before being fully discharged. First weekend away from the hospital, she got kidnapped by the Russian mob and taken somewhere else for forced prostitution to repay a debt she apparently had but nobody in her family knew about. Adding the other comments here so everyone can see it. Happy ending though, she was found and gotten to safety quite quickly because we had already spoken to the police about her delusions just in case, and they were quick to act when she disappeared. And yes, people got locked up and other women were found. It was, all in all, a happy/satisfying ending. Patient stated live cockroach in ear. I said probably not and ate my words. I had a patient in his mid-30s establishing care with me for difficulty reading. He actually came in with his mother and was very shy, which I thought was very strange. He said he worked at a library and words would get jumbled up while reading. He had zero additional issues. I actually did a very thorough neurological exam and found zero problems. I asked him to read a magazine out loud at different speeds and he did it perfectly. I said everything looked fine and wanted to order some labs. I honestly felt he was just a strange character. They agreed to labs but mom was very pushy to do head imaging. I said we could, but I ordered the CT as routine and by the time labs came back he was extremely low on vitamin D. I called saying we should replace it and hold off on the scan. Not only did mom not want the scan cancelled, she wanted an MRI and she wanted it stat. I basically got tired of trying to be reassuring and just ordered what she wanted. He had the biggest glioblastoma I have ever seen. Go mom. Without going into specifics, a patient was brought into our ER for the sixth time in 6 months with the same thing, fits, progressive neurological symptoms and a label of a normal MRI scan done 4 months earlier with a referral to a functional neurologist to basically deal with what was labeled as psychosomatic neurological symptoms on account of the patient having their first neurological event whilst they were on the phone, getting some bad news, having a normal MRI and having seen a neurologist who couldn't find anything wrong, again 4 months earlier. Thankfully, due to the patient rocking up in a wheelchair this time round as they were unable to stand, one of the senior ER doctors brought them in to do another scan. Cue me, walking in to see a crazy neuro patient who is going to see the specialist as there is nothing wrong with them. Until the very day I die, I shall never, ever forget my horror when I saw the repeat MRI scan on my computer screen just before entering the room. The patient had a golf ball-sized tumor in the very back of their brain and was in huge trouble with rapidly progressive neurological signs. I felt so terrible for both the patient and their family. The first thing I did was to tell them that we were very wrong, there was something physically wrong and apologize for the 10 or so times they had been sent home from ER and told that they had been making up the symptoms and signs. The family were just grateful that they now knew what was going on. The patient died a month or so later. I tell this to all of my junior colleagues and I am extremely wary of how people are labeled as having a fictitious illness when they present to hospital. My parents met when they were both teaching in a small rural town. The local doctor was notorious for diagnosing everyone with appendicitis. Headache? Must be appendicitis. Broke your toe? Appendicitis. Got a mystery rash? Have you considered getting your appendix out? One day the sports teacher went to see the doctor with abdominal pain. The doctor diagnosed him with indigestion and told him to go home and rest. The pain kept getting worse and worse, until eventually the teacher decided to drive an hour to the nearest hospital. Turned out his appendix had burst and the doctor completely missed his time to shine. Early in my GP career, young girl came in with a skin lesion on her forearm. I did a close examination and did not find any significant concerning features, promptly told her it looks benign. She then told me to look again and that it had changed in color. I took that as a warning sign and did a punch biopsy. Turned out to be a dermatofibrosarcoma protuberans. https://dermnetins.org/topic/dermatofibrosarcoma protuberans. I now have very low threshold to offer patients a biopsy of lesion if it even has any remote possibility of being something nasty. Radiologist here, and I only have one somewhat matching moment since my field is fairly objective. When I did a rotation in pediatric radiology, we had this father coming in with his kid. The kid was about 5, wouldn't eat properly and throw up a lot, and was very slim. I read their file and it stated that they were in and out of the hospital a lot for the same issue over the last half year or so, but no cause was ever found. It even said the father suspected his kid might have ingested something, but since the symptoms were so unspecific, this lead was never followed. So this time it seems they must have reinforced this suspicion pretty heavily, as they came to me for a functional fluoroscopy. First picture revealed a button battery stuck in the kid's esophagus. The father was so relieved that finally something was found, his eyes teared up. I read up on the file that the battery was removed endoscopically the same day and that there was significant inflammation of the esophagus due to leaking battery acid. Crazy to think that this dad suspected something along this line and it still took half a year to finally being looked into properly. Second not exactly matching story is from when I was in the last year at university, doing clinical internships. I was at this medical ER in a big city with a lot of homeless people and one day, this comatose guy comes in with suspected alcohol overdose. I remember him stinking of vodka. Each time when I tried to establish peripheral vein cannula, he pulled his arms back and groaned, which resulted in me missing the shot. The sixth time trying to establish the cannula, now on one of his feet, he still pulls his legs back and I start to feel really angry. I thought this alcoholic ass won't let me do my job properly, only to block an ER room for people who are really sick, just so he can sleep out his overdose. With the help of a few other guys, we finally got a cannula and drew some blood as well. 30 minutes later, the lab results come back and he had basically no alcohol in his blood whatsoever. So we did a brain CT scan and it turns out he had a cerebral hemorrhage. This instance taught me a lot about how easy it is to misjudge people and to treat all my patients equally, even in my thoughts. Obligatory not a doctor but worked as developer for a medical alarm company, think help I've fallen and I can't get up, and had a woman call my extension by accident complaining there was somebody calling through her device and threatening her. Notes on her account said she was schizophrenic and had this issue multiple times. She told me that she knows she hears things but I'd put her mind at ease if I could find out in any way, so I pull up the logs on cellular usage and see hundreds of calls and text messages of gruesome crimes and murders. Luckily the device had no way of showing them. Turns out the number for her device was part of what's known as the cartel scam, where people pretend they are members of a cartel and will murder you if you don't pay. They send pictures of cartel murders to intimidate you. I got her a new number and had a word with the people who kept dismissing her. Recently, patient with 70+ min downtime from cardiac arrest with all the signs of a big anoxic brain injury. Told the family that honestly there is no chance she has a meaningful recovery. She proved me wrong. Next day was off the vent and talking. I fixed her heart artery and she's doing great now. Not the doc, the patient. I was driving home on the interstate and my car started acting up. I pulled to the side and the fear/anxiety of being stuck in a dead car at such a busy/dangerous spot caused my blood sugar to tank. I was reaching into the glove compartment for glucose tabs when I passed out. I came to a police officer screaming at me. He kept yelling at me that he needed to know how much I had had to drink. I tried to answer, but couldn't form a coherent thought. Suddenly, an EMT pops his head between the front seats from the back seat of my car. He states, "Sweetie, we really need to know how much you drank so we can treat you." Seeing his badge, I was finally able to lock in on one thought. "Sugar," I blurted. Pikachu-faced, "Are you diabetic?" I nodded. He opens a package of glucose gel and hands it to me. "By the way, that stuff tastes awful." Halfway through the gel pack, I calmly apologized to the officer for being unable to answer him earlier. He had to scrape his jaw up from the floorboard of the vehicle. Some drunks are actually diabetics with severe hypoglycemia. Not a doc. I noticed a young woman slumped on the floor in a bus station, but everyone was ignoring them. I went over and asked if they were okay, but their speech was a little incoherent. "Hi, have you had anything to drink?" N. No. BR. Brain surge. Surgery. Oh, T. Ambulance called, and while we waited I was able to get some more info from her. She'd had surgery 2 weeks earlier, and something was clearly going wrong with it, possibly a bleed in the brain. Luckily I asked the question, and hopefully they were able to treat her before it got any worse. Smile. I work in vet med. This thread is wild because my patients can't even speak and we're doing RADs and full BW on a regular basis, and almost every post here is someone who can't get a diagnostic until they're half dead but they can speak and tell their symptoms and advocate for themselves. It's crazy. My friend has a brain tumor but couldn't get any imaging done for weeks, but her dog got cancer and got in the next morning. Not a doctor, but I was pregnant with twins. About 14 to 16 weeks into my pregnancy, I started to feel very full, like a basketball was in my stomach. I began to have difficulty breathing and would not be able to walk a block without squatting because I felt so heavy with this basketball feeling. I had to sleep sitting upright on the couch because I couldn't breath lying down. Some other weird stuff started happening too that I would Google and feel wasn't right. 3 times I brought up all these concerns to my doctor and she would wave them off every time. Even when I would ask her if she was sure, that was my first indicator. If I didn't feel confident with my doctor, I should have left and sought care elsewhere. At 23 weeks, I started leaking fluid and was sent to the hospital. The doctors were stunned to realize that my doctor overlooked a serious issue: twin-to-twin transfusion syndrome. I got on a helicopter to go to another hospital to have the surgery. But by then it was too late. My body was stressed and they were born alive and then died about an hour later. I then had to go have surgery again and into the ICU cause I wasn't doing so great. But yeah, she fucked up. Patient here. Told anesthesiologist that the general anesthetic was absurdly painful. He treated me like I was being a baby. He then paralyzed my lungs. His 4 missed my vein and I didn't get any general. I was fully awake and suffocating while flopping around like a dying fish. Last thing I remember before I passed out was the surgeon telling the anesthesiologist that I wouldn't remember anything anyway. Wrong.